Yesterday, the meeting will be being recorded. Today is June 10th, 2021. And yesterday, a lot of you may have seen in USA Today or some other media outlets that there was a recent study done that showed that looked at vaccine claims data from January 2020 until November 2020. They compared the claims that were submitted in that time period to the same dates the following year in 2019. And there were 26 million less claims submitted for teen and adult immunizations. That means 26 million less vaccines probably administered for our teens and our grown-ups. And were any of us that work in public health or healthcare surprised at that?
I'm not getting any
No, none of us were surprised at that because our offices were empty for a lot of that year. Many of you were closed, and even if you were open, your volume was just way down. And we are just now starting that hard work of getting those patients back into your offices and calling them all back in. So we are, as we start our summer tips series, we're doing so with like more hope and excitement than ever before, because we really think that it has never been so important that you all connect with one another and share what's working and what's not to get these folks back in. And also for us at TAPI, so that we can learn from you about what it takes to reconnect with those patients and reconnect with those families. So we are so excited to be launching our tip series today. My name is Rebecca Nevedale, and I'm with TAPI. And Macrina, do you want to say hello?
Hi, I'm Marlene from Coy Family Medicine in Chandler.
Hi. Macrina, is Macrina on yet? She might be having trouble. Well, I always come with a nurse. Today, my nurse is Macrina. I'm just a regular person. So Macrina will be here today to answer all your clinical questions and things like that. And then also, as the series go on, you might see other nurses too. So I'm sure she'll log on. I know she's not in clinic today, so she'll probably get on quicker than a lot of our TIPS respondents will, who are still in exam rooms. So TAPI we are both members of the Arizona Partnership for Immunizations, or TAPI. We are the public-private partnership for immunizations. And our mission is to foster community wellness and advocate for good public policy and best immunization practices. A lot of you are already members. We have over 400 coalition members. So medical offices, schools, pharmaceutical companies, healthcare centers, grandmas who really are passionate about vaccines. There's lots of variety and diversity in our membership, and we all work together to improve vaccine outcomes. And typically we travel around the state of Arizona in the summer so that we can visit you in your space and learn about what great rock stars you are. And we really love, well, first of all, everywhere is cooler than Phoenix. So we always love traveling throughout the state in the summer. And the only place not cooler than Phoenix is Yuma. And we have some really good restaurants that we like in Yuma. So we feel like we're just as happy to go down there, even though it's just as hot or hotter than Phoenix. But we also just like hearing about your communities and the different immunization champions that are in your communities that aren't in ours. Pastors at your churches, really amazing school nurses or businesses that promote vaccines. So we're sad that we won't be able to visit you this year. But one of the good things about not visiting you is that we always hear at the end of our TIPS trainings, man, I wish the other MAs were in this training, or this would have been really good for my practice manager. So we really hope that you're bringing in your whole team. We see a lot of you huddled around the same computer, ordering lunch, which is great. And we are going to launch this poll here to see how many people are in the room with you. So if you don't see the poll, just click answer the question. It should be pretty easy. Hopefully many of you know if you're by yourself or not.
Okay, I'll go check our MA. I couldn't see him on our.
Oh, that'd be great. Yeah.
Rebecca, this is Annette from Greenlee. I just joined in on the call. How many people are in what room? Like the room that we're in right now, or an exact?
There's 160 in the room. Did you have trouble getting logged in?
No. I'm like, what room? Where?
She's asking if there's anybody else with you.
In like the physical room that you're in, if you're watching this with somebody else.
Oh, like, okay, the room right now. Okay, got it.
Do you see any other faces in person right now? Yeah. Yeah, this is important. You'll see this question pop up every few weeks during this tips training for our funders. They want to know how many people we reach. And we want to know, how many people, what the demand is for these kinds of trainings. So, all right. So I think we got a critical mass. And I'll share the results just for fun, because it's always fun to watch. So most of you are alone, but some of you are with larger groups. So we always like to, one of the things that we miss when we're not all in person together is not knowing what role everybody has. So when you registered, we asked you, what's your role in the clinic? And about a little over a third of you are nurses, a little over a third of you are medical assistants. Half of you have been to TIPS before. And half of you are brand new. So for those of you who are brand new and have never been to TIPS, you will learn that every day at TAPI is Hug and MA Day. We really believe with everything that our medical assistants and our nurses, the whole vaccine delivery system is on your back. And I think that over the last year, we've been really inspired by all of this recognition healthcare workers have received. And for being the heroes that you are. And we just want to make sure that those administrative staff folks, the medical assistants, and your practice management staff, your billing staff know that you are not a second tier hero to us at TAPI. We know that while we were safely working from home, many of us, and staying away, you couldn't. There were lots of pictures of doctors and nurses, and that's great. They deserve all of that credit, but we just were feeling through the pandemic, man, it should be Hug and MA Day because we know you were right alongside them. And for our world in vaccine delivery, you're the ones who are having a lot of those difficult conversations with families, especially with like new moms and new dads. And you're also the ones keeping the system afloat in terms of data entry and accounting for all those doses and ACEs. So we are so inspired by everything that you do. And we really love you. And we hope that by the end of these 10 weeks together, you will feel that love, just like we hope you're getting it from your providers and from your families in your office. So we have, for those of you who are new, our TIPS trainings are a little bit different. We try to keep things kind of light and fun and conversational. And the reason why is that we've just learned over the years that if we do that, we get the real story. We hear a lot more about what your families are really asking you. And we get what those real questions really are. Our other kind of guiding principle or ground rules is that we are all human. We will make mistakes. We promise you that we will make mistakes. And we might say things that you think, wait a minute, I don't think that's accurate. Please let us know when we do that so we can correct any information. We'll try to keep things pretty interactive. We'll do polls. You're welcome to unmute yourselves and ask questions. If you feel like you can't get it out, it's easier than writing things in. And please use that chat box on your Zoom screen in the bottom or top right corner. You'll see where it says chat. Looks like most of you have already found that. And please be sure to put in whatever questions you have about vaccines. We'll try really hard to answer all of them. And if we don't get to them in that session, we'll bring it up in the next session. So use that. And all your questions are good questions. Like some of us have been doing this for many years. I think Macrina's on now, right?
Yes,
Yeah.
I finally on. Thank you, team, for all the hard work.
So Macrina, hours a day do you think about vaccines, or do you work on vaccines?
You know what? I think about them all the time. I mean, I really think it's 24/7, even when I'm at home watching TV or I'm doing hiking, it just always goes through my mind. I'm a vaccine nerd and geek. I love them. So I think about them all the time.
Yeah,
And it's perfectly okay.
And Macrina's job is just vaccines. I mean, that's all she does at Maricopa County. She's the nursing program manager at Maricopa County Department of Public Health. And she does a lot of other nursing things too, but really she's spending a lot more time thinking about vaccines than you are, who are also worrying about asthma action plans and, you know, birthday celebrations and whether you're allowed to do them anymore or not for your MAs, and, you know, all of those things that happen in an office. So, and she still has questions all the time and looks things up. So feel free to ask whatever questions that you need. Okay, so that's all our ground rules and things. Looks like some folks are already asking, is the recording going to be available? Yes, it will be. We promise. We know that a lot of us have internet troubles. Today I'm having dog troubles. I asked my husband to lock her up, but she's whining, so you'll just hear her too. So today we're going to talk about why are vaccines important and protecting herd immunity. So before we do that, we will go over just a couple like key terms and phrases just to make sure that we're all starting at the same spot. So morbidity is the incidence of disease. Mortality is the rate of death. So in 2019, the World Health Organization reported that 20 million people worldwide got measles, which is probably surprising to many of us who are in a country where measles is not common. 140,000 people worldwide died of measles. So that's the mortality rate. So we reduce morbidity and mortality of diseases by implementing evidence-based public health practices. So think about the last year, we were trying to reduce morbidity and mortality of COVID-19. So to do that, we wore face coverings, we practiced social distancing. Some people learned how to wash their hands apparently for the first time. There was a lot of TikToks and a lot of videos on social media about how to wash your hands. Hopefully we all already knew how to do that. And hopefully now that we are starting to enter public restrooms again, they will continue washing their hands and we'll all see that. Vaccines are one way that we reduce morbidity and mortality of disease, but they're not the only way that we chase down those numbers. The next key term is immunity. So immunity is protection from an infectious disease. If you're immune from a disease, you can be exposed to it without becoming infected. So we use these two terms we exchange them in and out. We say coverage rates or we say immunization coverage. But what we mean when we say that is the estimated percentage of people who have received specific vaccines. So there's lots of ways we can get immunity, right? We can get immunity by getting the disease. We can get immunity by being immunized against the disease. Pregnant people pass immunity on to their babies. So babies actually get immunity for certain things from their moms. But vaccines is kind of the easiest, most cost-effective way to get immunity. So monitoring immunization coverage is super important. CDC does it. All your local health departments do it. Your state health departments do it. And you even monitor it at your practice level with your practice population. Your health insurance companies, so your payers want you to do that because some of them will pay you a little more if you get higher coverage rates. And you know that helps make sure that your community and your patients are more protected. The reason why we monitor immunization coverage is because we are all chasing herd immunity. So herd immunity is, and I'll just read this, it's the CDC definition. A situation in which a sufficient proportion of a population is immune to an infectious disease through vaccination and or prior illness to make it spread from person to person unlikely. Even individuals not vaccinated, like newborns and those with chronic illnesses, are offered some protection because the disease has little opportunity to spread within a community. So that's how CDC defines it. The reason why we're hearing a lot about herd immunity, I mean, you're hearing it from people who you've never talked about healthcare to, you know, your next door neighbors or friends or your parents and family members. It's a phrase that's becoming a lot more commonplace. It's not a phrase that's new to those of us that work in infectious disease or in vaccines, but we are trying to achieve herd immunity for all sorts of diseases so that we reduce our morbidity and mortality rates. And we do that through immunization and lots of other ways. So we just always find videos, other people explain things better. And now that I think about that, I think I forgot to turn the sound on my video. So let me do that. There we go. Quick change there. So I'm going to play this video. It's about 5 minutes, but it does a pretty good job of explaining herd immunity.
Most people are familiar with vaccines and how they offer individual immunity against a disease, but they might not understand how the people around us or our herd offers immunity to everyone in the herd. A herd is a group of mammals that are living together for protection, maybe protection against lions in Africa or wolves in North America. But how does that apply to humans and disease? Well, let me show you a little model I put together. So we have these individuals in a herd, and let's say one of them gets sick, and the infection rate of this disease is 50%. There's a 50% chance you could pass that on to another individual. So this person is in close contact with 1, 2, 3 individuals, and so I simply flipped a coin. Heads, you get sick, tails, you don't, and 2 of the people got sick. I then took those individuals and flipped coins for the people around them, and this person, for example, infected 1 individual, and this person infected 2. And then I just kept doing that over and over and over, and you can see how the disease spread through the population. Now, how quickly a disease spreads through a population is based on how many people you can infect, and we call this the basic reproduction number. What is that? Well, for this individual, they infected 2. This person infected 1, this person infected 2, this person infected 0, and if I take a number of those individuals and find their average, that's going to be my basic reproduction number, or R naught. If R naught is ever less than 1, in other words, you can infect at least one other person, then the disease dies out. But if you've ever heard of a disease, that means its R naught value is going to be greater than 1. And so here's some R naught values for some diseases you might be familiar with. So the recent outbreak of Ebola, R naught value 1.5 to 2.5, smallpox 5 to 7, but some diseases like measles and whooping cough, the R naught value might be as great as 18. That's because it's an airborne transmission. And so what happens after you get a disease? Well, you get sick, and in some diseases you might even die. But if you know anything about animals, we can gain immunity to that disease. Once we've got the disease, we're not going to get the same disease again unless it mutates highly. And so what these people with immunity do is they offer protection to everyone else within the herd. So let's see that disease comes in again and it starts to spread through a certain part of the population. Well, the rest of the population can't get it because these people with immunity offer a fire break or a firewall against that disease spreading into the population. And so once our herd gets large enough like this, even though a lot of people don't have individual immunity, they have herd immunity. So let's say a person like this comes in who's sick, they're surrounded by so many individuals who are immune that the disease can't spread to those who are susceptible. And so the problem with this is you have to get sick, or you have to have members of your population die for you to get this herd immunity. But science has come up with a solution to that. It's called the vaccine. We give you a weakened or a dead version of that disease, and then you can gain immunity to it. And so that's wonderful. And you might think, let's go back to that model again. Let's simply vaccinate everybody. If we vaccinate everybody, everybody has immunity. But we can't vaccinate everybody because it's a voluntary process to get vaccinated. Some people don't want to. You shouldn't get like a measles vaccine if you're a baby or you're a pregnant female. And then as you get older, you may lose some of this immunity. So not everybody can be vaccinated. It just simply doesn't work that way. And so what scientists have come up with is a herd immunity threshold. What does that mean? It's how good is good enough? What percent of our population do we have to have vaccinated or immune to the disease so we all get this herd immunity? Well, it's going to depend on the R naught value of the disease. So if it's something like mumps with an R naught value of 4 to 7, we have to have at least 75 to 86% of the population who is immune so the whole herd can gain immunity. But as those R naught values get greater and greater and greater, like 18 in measles, we have to have 94% of the individuals immune. And so as people decide not to get vaccinated, what's going to happen? We lose that herd immunity and we're going to have outbreaks of disease. So if you live on the plains of Africa, you're protected in a herd against a predator like a lion, but who is the lion that's stalking us? It's the disease, which is hiding in other individuals around us, but we also now have to worry about the individuals around us. Are they immune? Are they vaccinated? If not, they're not only putting themselves at risk, but they're putting the whole herd at risk.
All right. So that is herd immunity, according to that guy used to be a science teacher. And that's actually a little bit of an older video. It's about 6 years old. So some of those, you know, as we continue to get science and more outbreaks, some of those thresholds have changed a little bit. But we'll show you in a minute what they are now. So anybody have questions about herd immunity? Because we just feel like it's kind of a hard concept to get. And you can type them in or say them out loud. All right, well, we'll keep our eye on the chat if you're still typing some stuff in. So here's what our thresholds are for different diseases. So for measles, we really aim for 95% coverage for measles. And again, that's either through because they already got the disease or because they got the vaccine. So we don't necessarily need 95% of people to get vaccinated in some of those countries where measles is still really pretty common. In our country, it's not common. We need 95% pretty much to be vaccinated or to have had it in the past, which a lot of people actually have, right, Macrina?
Oh, it's getting less and less. When you start, you know, it's getting less and less because the younger population are being immunized.
I know some of those, like what, like the.
So it's folks born before 1957 are more likely to have had natural disease. So if you think about it, as our population gets older, then those folks who have had natural diseases are no longer with us. And so we're seeing more and more protection from immunization than we are from natural disease.
Okay. And pertussis is about the same. We're looking for 94% immune, but then things like mumps, that's 86%. That's a much lower threshold that we need, but look how much lower that R naught value is. If you get mumps, you're only probably going to infect 4 to 7 people. Whereas if you get measles and you walked into a completely, you know, novel or unprotected community, then you'd infect 12 to 18 people. So we have lots of herd immunity stories, but when we were on our way home from Sholo 2 summers ago from doing a TIPS, the phones just started like blasting. There was a measles case in Maricopa County where I live in Phoenix. So Macrina, tell us about that case.
Right. So we had someone dance competition, a hip hop dance competition, international hip hop dance competition. And so we had people from all over the world. We had a young girl from New Zealand who came for the competition. And as all young girls do, they hung out at the mall. That's something that hasn't changed over time because that's where I used to hang out as well. And she went to the movies and she went to the food court and she went shopping and so she went back and she won the hip hop competition, by the way, #1. She gets back on a plane, goes back to New Zealand, and then we find out she has measles. And as you can tell, measles is highly infectious. So we jumped in and did what public health always does. And the mall she hung out at was Arizona Mills. So we did everything we normally do. We notified the theater, the mall, the food court, we hung signs, we called people, we did everything. And we had absolutely no spread of disease. We had no spread of disease from any mall exposures. We had no spread of disease at the hip hop competition, which was taking place in the Southwest region of Maricopa County. We had no disease from the airport. So what that tells me is that we had good herd immunity in those areas. And keep in mind, measles can live in the air for up to 2 hours when someone leaves. So a lot of people said we were lucky. We weren't lucky, guys. That was a testament to all the hard work that you do every day. That was a testament that you make sure kids have their MMRs, that you make sure they get that second dose. So all of our hard work paid off. We had no spread of disease and everyone stayed healthy.
You know, I think it's also a testament to the people in those communities. So that like South Phoenix, Tempe, you know, that kind of border area, Guadalupe, all that, those families prioritize immunizations. When you look at coverage data for those zip codes, it's really high. I mean, they really do prioritize immunizations, and it is super challenging for some of those families to get to access healthcare. And I think that the offices there make sure that they can make it accessible too. So we, you know, a few years before that was when Mickey Mouse got measles. I'm sure many of us remember that one. And we had some small outbreaks in communities that we had lower coverage rates. So I think that it's such a good herd immunity story, that hip hop competition. The other thing that when I watched that video, Macrina, that I'm wondering is he talked about mutations, like a little bit. So how does that have to do with herd immunity?
Well, so the less number of people that are immunized or protected or immune to his disease, the more likely it is to spread and infect folks. So every time a virus goes from person to person, there's the opportunity for it to get a new variant or to get a different type of virus. So that means that either you need a new vaccine sometimes you don't. So to actually stop variants from happening, we need a lot of people immunized so disease doesn't spread and is able to change.
So you really need everyone, not everyone, but you need that percentage of folks immune at the same time for that variant, which is why when we look at it at a community level, like, you know, somebody going into you know, South Phoenix and it not spreading very much is much different than when we look at it with a state perspective, a national perspective, or a worldwide perspective. So.
Well, and that's why when somebody says, well, it doesn't matter to me whether or not I'm immunized, I don't care if I get the disease or not. Well, I care if you get the disease or not, because if you get the disease and you could help that disease shift into a different variant, then my vaccine doesn't work anymore. So we really are in this together. That's the information you need to share.
All right. So we know what herd immunity is, or, you know, we heard about it again. We know that we're trying to do that to reduce morbidity and mortality. That's why we look at coverage rates, and we want everyone immune to the disease, hopefully through vaccines, if there is a vaccine for it. So now let's look at our coverage rates. So how are we doing in meeting those thresholds? So this slide shows data from the National Immunization Survey. This is something that CDC annually does. It's not perfect data, but it's data that all states have access to, and they use the same methods. So I'm curious, when you all look at this slide, and you can put it in the chat if you can find that chat, what jumps out to you? And I have Hep B. Okay, Erica Nelson, first one. She gets a prize. We'll send Erica Nelson a prize. Hep B. Yeah, that's low. Is that just and that's for 3 Hep Bs, right, Macrina? So that's not just birth dose.
Yeah, that's 3 Hep Bs.
Okay. 1 varicella. Yeah, that's high. That varicella one. Why is that so high? I don't know. When is that given, varicella?
12 months.
12 months. Well, I guess that's an important one. Yeah. Important visit.
Yeah.
A couple people are saying DTaP.
Yeah.
The DTaP one stands out. Those of you who've gone to TIPS trainings before know that DTaP's one of my favorite vaccines because the pertussis, too many have heard that baby cough too many times in my career that it just breaks my heart. So I think we should talk about that. Right now we have 53 documented cases of pertussis in Arizona. That's pretty low. But remember, we've all been kind of locked in our houses for the last year. And even people with infants are still not really bringing them out and about because they're scared of COVID. So, but what are the symptoms of pertussis? Macrina?
Well, with pertussis, you get this cough, and it's such a deep cough that to catch your breath, you have this whoop, which leads to whooping cough. And usually the cough is so severe that with infants, they can't get enough oxygen into their system. They can't eat or nurse because they just can't catch their breath to nurse. They have a lot of emesis, they throw up a lot. And shockingly enough, this is also the symptoms we see in adolescents and adults. The cough is so severe that they throw up after the cough, they can't catch their breath. Sometimes adults will break ribs, they're coughing so hard. I mean, that is really, truly the sign of pertussis.
Well, that's what happened to Monica, didn't it? Didn't Monica?
Yeah, no, I had a nurse who had gone to several providers, gotten several inhalers and several antibiotics, and she had gone to a pulmonologist and all sorts. And then it wasn't until she went to the emergency room and they took a chest x-ray and saw that she had broken a rib without having any trauma. The ED physician said, "You have pertussis." Didn't do any other test, just looked at the broken rib and took a history.
Yeah. So how do you treat pertussis? What's the treatment?
Well, there is a treatment. There's a antibiotic treatment that you can take. Sometimes it gets so deep into the disease that sometimes it's not as effective. But you also need to treat those around you that have been exposed. So that's where you need to do contact tracing. Who have you been in close contact with? What is the time frame? And then you have to treat them as well so that they don't get the disease and able to pass it on. And the problem with a lot of our adults is it takes a long time before we diagnose our adults. So they've really exposed a lot of people. And I don't know about you, but honestly, it's hard for me to remember everybody I've seen in the last 3 to 5 days.
Yeah. Yeah, especially now that I'm leaving my house again. But
oh, yes.
Yeah. So preventing babies and pertussis, or how do we prevent pertussis in babies? So there's two main ways how we do this. First is this concept called cocooning. So making sure that everyone around that baby is immunized against pertussis. And remember, this is one that we need to make sure that we all have gotten in the last, in our adult life, or in the last 10 years. So making sure new moms, new dads, grandparents, parents should feel perfectly, it's well within your right as a parent to ask your daycare providers or childcare workers, whether or not they've been immunized against pertussis and see what they say. But what's the best way to prevent pertussis in babies?
The number one most effective way that we can almost eliminate pertussis in babies and babies being hospitalized in the NICU or dying is to immunize the mother in the 3rd trimester of pregnancy. That mother has the closest contact to that baby, number one. And number two is that baby will be born with some maternal antibodies to pertussis, and they will be born already partially immunized. It's not going to last that long, but they got some immunization on board. Number one way to protect against pertussis.
So if your practice cares for pregnant women or sees pregnant women while they're bringing in their other older children for well visits, every pregnancy, every 3rd trimester, it doesn't matter if it's an Irish twin and she was just in those shoes 10 months ago, she needs to get that pertussis shot again.
Because we're basically immunizing the baby.
Yeah. Annette's chatting in how they had a pertussis outbreak in Greenlee County a couple years ago. Yeah, contact tracing for pertussis. Woo.
It's not easy. And the
No.
last thing I really want to do is, no one really loves hearing that your county health department is calling.
No, we don't really want to
We
hear.
never,
guys.
we never call with good news.
Yeah. So this map shows how we compare to the other states and territories in our country. So this is kind of like a sad map. So over the last, I don't know, 10 years or so, the last number of years, we've been in kind of the bottom quarter in completion of the series, the 2-year-old series by the time they're 3 years old. So right now we're at 63.7%. We are third from the bottom in our rates when we look at us compared to other states. So not the happiest news. We know that we will talk a lot about babies and baby shots over the next couple of weeks. 85% of you are members or vaccine for children providers, VFC providers. So you get to immunize all those squishy, cute, fluffy babies. And we will focus on all of those vaccines because they are all important. We don't have, we don't recommend one over the other, but we wanted to just highlight to you where we are pretty low in our, really pretty far away from those herd immunity thresholds. So for DTaP, we're doing pretty good on polio. We always do really well on polio for some reason. Looks like we're doing well on MMR, which is really good news. Remember, this is 2020 data, but these are kids that turned 3 years old in 2017. So it's a little bit stale. We hope that this doesn't look much worse and will only look better, as we start looking at NIS data in future years. But we do have definitely areas where we're doing well and definitely areas where we can make improvements. So why is herd immunity so important for babies?
Herd immunity, it's so important for babies because babies aren't fully immunized. It takes, for a lot of those vaccines, 3 to 4 doses before you actually get good protection. So those babies are out and about in the world without having protection on board. So everyone around them needs to be protected. So if you think about it, if that baby goes to the grocery store, everyone in that grocery store is part of that baby's herd, is forming that baby's cocoon. So that's why it's important that the community be immunized to protect babies.
Plus, the one thing we know about babies is they get bigger. They get a lot bigger. So they grow up to be children and teens and adults with immunity. And if we don't do a good job with protecting some of those, with getting them those childhood vaccines, for some of them, they'll never get them again. So would I have had my last MMR shot? I haven't gotten that, right? When do I finish my MMR vaccine, Macrina? You were probably already working at the county then.
In fact, I probably immunized you. You should have been, prior to entering the kindergarten. So you should have been 5 years old. That's where you get your second.
Right. So that's 13 years if I wasn't immunized as a child until I'm 18 and can make that decision on my own. I mean, we really need to make sure that we get those babies because they are going to grow. So let's switch over to our school-aged kids, the ones with the cute little backpacks. They're starting to get ready to come into your offices and get their shots. So we do have NIS data for school-age kids, but there's another indicator that we really look at, and that's personal belief exemption rates. So every state in the country requires vaccines for school entry. It is an incredibly effective public health intervention to improve our immunization coverage rates for those diseases. You will see, and you see it in your offices. I mean, those few weeks before school, or those few weeks after those nurses send out those letters to parents saying, if you don't get your kids shots by this date, they can't come back to school, you get flooded. So Arizona school exemption, we are in the top 10, and again, not the best way for school exemptions. About 5.7% of our 5-year-olds are exempt from have submitted an exemption form for at least one vaccine. Now, some states do not allow personal belief exemption, so we think that's just an important thing to keep in mind. But many of us do, and in Arizona, we do, and that's okay. So parents have the right to choose whether or not they want to immunize their child. And as healthcare and public health advocates, our job is to just give them the information so they can make whatever they think is the best choice for their kid in their community. Phoenix, this study was released just right before COVID time, and noted the city where I live, Phoenix, as the #1 urban hotspot in the United States for school exemptions and the number of kids at risk. You'll see there's a lot of these states with high exemption rates or urban centers, you know, big cities kind of west of the Mississippi there. But it does kind of highlight why we do really need to work together, because we are in an environment that is very different than some of the other states are experiencing. And we really need to work together to educate our families and to make sure that we keep our system strong. This slide here shows our personal belief exemptions just for measles in Arizona, and it shows it by county. So in Greenlee County, where Annette's at, half of her schools have community immunity levels. So that right column there is not immunization coverage levels. That is the percentage of schools with community immunity. So half of those schools have reached that 95% threshold. Half of them haven't. In Santa Cruz County, who is always rock star vaccine on immunization coverage, 82% of their schools have community immunity. So those kids, at least 95% of them are immunized against measles in kindergarten classrooms in Santa Cruz County. I think, you know, DHS has all of this data available to us on their website. And it has been such a game changer, I think, for community members to know what these coverage rates are and who's exempting from vaccines. I mean, you don't know who's exempting from vaccines, but globally, how protected your school is or your community is. They have a fabulous tool where you can look up your own kid's school or your niece's school or your grandkid's school and just help you make a better decision about where you want to choose your kid go to school, and also provide an opportunity to advocate. You know, call your school nurse and ask why he or she thinks that it's so, why the exemption rates are so high. Or present at a school board meeting or a PTA meeting about why, as a parent in this community of a child with an immunocompromised, you know, with not a great immune system, that I'm really asking you to immunize your kids. So it's been a really good game changer. And I think that provides us with a lot of hope as data becomes transparent that people can do things about it. For when we look at 6th graders, kindergartners and child care workers, we're talking about 8,150 children who have submitted exemption forms for every required vaccine, not just measles. It's a lot of kids. It's a whole lot of kids. And then there's fun maps on ADHS's website too, so you can look up your community. I'm going to launch this next poll here. Oops. True or false? All Asip recommended vaccines are required for school entry. And I think I'll go back to the maps too. So after you answer it, you can look at your measles. I like the maps. We're still waiting on the map for the full exemption for all of them. We just have measles for right now. We'll give you like 5 more seconds. 1, 2. All right. Sharing results. So what was the answer to that question, Macrina?
False.
False. So what are they supposed to do with that? So in Arizona, actually in every state, the ASIP schedule never matches the school requirements. The school requirements are like through either a rulemaking or a legislative process, depending on where you're at. ASIP is a scientific body. They rarely match in any state. So what are they supposed to memorize them?
No,
Oh.
don't memorize school requirements. you need to know what the recommended schedule is. I always tell people, I know HPV is not required for middle school, but we always say what you need is a Tdap, an HPV, and a meningococcal vaccine today. But remember that pneumococcal vaccine isn't required for childcare, but most folks get pneumococcal, don't they? So I think we need to recommend what the schedule is, and tell them that these are the vaccines that they need to stay healthy. Whether they're required for school or not is irrelevant to me as a nurse who administers vaccine.
I think that really is, having offices and those, and, nursing staff and medical assistants and doctors talking about what the science recommends you to do rather than what the school makes you to do can be such a huge game changer, because we don't want to recommend we don't want these young girls to get cervical cancer just as much as we don't want them to get hip. We don't have
and we never do. When a baby comes in, we say, now, pneumococcal is not required for childcare. We never say that. We never preface any of those baby vaccines versus required for childcare or not required for childcare. So I would do that with school or adolescent vaccines.
Right. So if you take one thing from tips this summer, it's don't talk about requirements, just talk about recommendations. It will go a huge way in helping our school and helping our immunization coverage rates. But we do want to make sure that that this is my favorite graph, like, of all time, because this was reported measles cases in the thousands. So in, let's see, 1960, we had about 775,000 cases just in the US of measles. And that dip comes because the vaccine started. The vaccine came out, that first dip. This second dip here that happens in just a few year period, about a 4-year period, was the time when states started requiring measles vaccines for school entry. So it's not that those school requirements aren't a really important driver of us getting immunization coverage. They're critically important. It's just that we need to talk with parents about all of the vaccines equally. And Lynn's, commenting in there, but it's hard to explain to parents, though. We try to get our schools not to say your child needs 2 shots. They just need their 11-year-old immunizations. That's a good takeaway for Tappy, I think, too, to talk with schools about that, Oh, I like that you guys are talking in the chat. I hadn't looked at it, but I got to get back to my data. Okay. But keep talking in the chat and then I'll read it afterwards. So let's look about our teenagers. Macrina always says they're the easiest to immunize.
Oh, give me a 5-year-old any day.
Yeah. So our teens, I'm really excited about this NIS data for our teens, because we are making improvements. It's one indicator is not necessarily a trend, but one jump isn't a trend, but it still gives us some hope. Look how fabulous that Tdap and MCV are. Those are phenomenal coverage rates for those teens. Yes, we need to go a little further, but they're still really good. And the other thing that makes me excited is those HPV rates just continuing to climb. And for those of you who are newer to vaccines, Macrina, talk about what it was like HPV in the beginning.
Well, anytime anything is new, I think, first of all, we started out with HPV a little behind, because I don't think anybody knew, none of our parents knew that cervical cancer was caused by a virus. And so we had to sort of teach that to start. But parents are always a little bit leery about everything that is related to a new vaccine. And this vaccine came out in the world of social media, right? So then we all started talking about our young girls having sex, and then I just kind of got crazy. And then a few girls passed out and hit their heads. And then all of a sudden we had YouTubes about that. And so I just think it's with any new vaccine, especially in the world of social media, it just takes a lot more work for us to get it implemented and get it moving. But I think, as we can see, it's working. You just got to wait for a new vaccine to come out. So when a new vaccine comes out, then that one all of a sudden becomes old.
Becomes old news. Yeah.
Yeah.
You know, this is one that for those of you, I know that for some families, this one still requires quite a long discussion. And I know that it also involves, you know, kind of 2 or maybe 3, or if it's a family that brings grandma and aunts and everybody into the exam room, 10 people saying, yes, we should be able to get this vaccine and opting into it. But this is so critical. I mean, we live in Australia. They required this for years ago. So now they haven't eradicated HPV from Australia, but it's pretty darn rare. You have like residents and people who've done medical training who've never seen a new case of genital warts because everybody's been immunized against HPV. But in our lifetime, and I believe with every inch of me, we will see a world where women do not get cervical cancer. These little girls can grow up and never have to worry about cervical cancer. They won't have to worry about pap smears all the time, oral pharyngeal cancer you know, that could be gone. I mean, it's an incredible technology, and you're so lucky to be part of that. So we know it's a hard fight, but man, it's worth it.
Well, and I think part of it is when they went down to a 2-dose series, the younger you are immunized, I think that's a really easier story to tell to parents, or because we give it at 11 to 12 because the immune response is so incredible. I mean, it's incredible. And then when they start talking about that adult behavior that children are going to have and sex, I always go down to the line that, well, you want to be a grandparent one day, right? And then they're like, oh, okay, yeah, I get it. So it's sort of like putting it in a term that they sort of can relate to their heart. And so the idea of their young daughter having sex scares the heck out of them. But the idea of them being a grandparent in 10 years or 15 years makes them happy. So then they kind of think about it that way.
Yeah. All right. So we're done with kids. Anybody have questions about coverage rates or herd immunity for our kids, teens, kids, babies, youth, babies, squishy little vascus lateralis? All right. So for grown-ups, our coverage data stinks. So we don't really have a lot of really good data sets that we can look at for adult immunizations. One of another secret, you know, hidden blessing of COVID, I really hope will be that this will change, especially because who administered our first COVID vaccinations? Adult providers, people who only care for adults or mostly care for adults or geriatric patients. A lot of those people now have wrestled through getting their HL7 interfaces done. They're now just dumping all of that data right into ACEs. So we'll have more information there. Before we started the pandemic, there were over 8 million records for adults in ACEs. So the data is there and it's coming. It's just not as clean yet. So hopefully we'll have a better idea of coverage rates for adults in the future. But we do know quite a bit about flu. CDC does measure that. And not surprisingly, healthcare workers, which is what they look at, your hospital systems do have the highest rates for flu immunization. Ambulatory and primary care, which is pretty much who's on here, are not too far behind the hospital systems. This is old data for those of you who were there last year. They haven't updated this with the current information yet. A lot of the CDC data is a little bit just delayed because those people have been focusing on COVID, but it's starting to come out from this year and last year. This is what we want to just highlight, that the lowest rates for flu immunization by occupation are our medical assistants and our other aides who really are doing the bulk of immunization delivery. So we just want to make sure you know that. So talk to your friends, and we know you're the immunization champion. You get your flu shot. We know that there's other reasons why people might not get their flu shots, but please make sure that your colleagues are getting their flu shot, because how do you recommend it if you don't even get it yourself? And here's just a fun flu fact, that flu vaccine reduces the risk to adults and pregnant women for being hospitalized by 40%. So nobody wants to be in the hospital. Any other questions?
I had
Oh, go
been-
ahead.
I've been
Sorry, Erica.
pulling, I was just typing, but I've been pulling kids 12 and up for their COVID shots or checking them on ACES, and not all of them are integrated. They have their cards and stamped, but they're not in ACES. I don't know if you
are
need
they-
to know that or not, but
Are they all from, have you noticed who the provider is? Have you let that provider know? Because it says where they got their doses at.
yeah, I believe majority of them. It's not as frequent as new for the younger ones, but when we remember to get them and pull them to add them into their systems, it seems like it's CVS.
Oh, okay.
Okay.
So I don't know if you just keep an eye on something like that for yourself.
Yeah, that's really helpful for us to know, because it's, I'm sure you know how your own ACES stuff works. It's probably a flip of some sort of switch
Yeah.
that didn't get flipped right. Are you entering in those historical?
Yeah.
Yeah. Oh, thank you. Yes, please, everyone enter in all the historical information. It makes the next person's job much easier when that patient moves or chooses a new provider. So yeah.
That's it.
Yeah, that's really good for us to hear. Anybody else have anything or questions or anything like that? People are asking about boosters. We probably need for COVID-19. We think we'll need them, right, Macrina? Probably late fall.
Well, the manufacturer says we're definitely going to need one, but the ACIP and CDC and FDA really haven't come up with anything. They're thinking maybe a yearly booster, but they're really not sure. So I think just stay tuned.
Stay tuned.
It's one of those things, and honestly, tomorrow they could come up with the answer.
Yeah. So don't log off yet, because I have a very grand prize to give away. But there is going to be an evaluation that goes out after this, and we're not sure, we know all of these other vaccines are so important. You're just starting to get patients back in the office and doing these reminder recall systems and things. We're trying to figure out how do we balance the tension of, we need to focus on all our vaccines, the regular vaccines that are our bread and butter, we are still in the middle of a pandemic. So if you need special COVID kind of time on these, we can make that. We can carve out 10 minutes or 15 minutes, even if it's just, let me just ask random things on the top of my head. Let us know that on the evaluation, or go ahead and put those things in chat. We know some systems are a little bit better than others about making sure the information about COVID-19 gets all the way down the chain. So let us know. I'm going to launch a poll, because we're almost at time. In 1980, I was, and I have a $50 gift card I'm allowed to give out. If anybody, without Googling, can tell me what major public health vaccine advancement happened in 1980. We do take guesses. Smallpox. Oh, Luz gets $50, and we hope you use it to buy lunch for everybody who works on vaccines in your office. We'll contact you afterwards. But if not, we're not going to check and make sure. So, but yes, smallpox was eradicated in 1980. The last cases were in 1977. So, I mean, Guy, you are all the protectors of our community immunity. It is the entire delivery system for all these diseases is on your shoulders, and we are right there. I mean, for some of these diseases, we've already passed the herd immunity threshold, and you are helping us keep there. For some, we are just a few percentage points away, which means each of you just spending that extra time with one patient on one day to give them the information so they can make the decision to vaccinate is going to make a huge difference. And for some, we feel like it's a really long way off. I mean, for COVID-19, we looked at the recording of the first tip session last year. It was June 9th, 2020. We were mourning the loss of 1,095 Arizonans. It is 1 year and 1 day later, and there are 17,715 Arizonans have lost their lives to COVID. We know what happens to a community when a novel virus enters and that community has no immunity. For these diseases that you immunize against every day, that's what you're preventing. I mean, that it was really striking and remarkable for us to see those numbers because we've been living through it and we're kind of desensitized. But this is a really huge deal that we keep these herd immunity levels up, coverage levels up, and then we get close to those thresholds. So we do want to just thank you for everything that you do to do that. We're really looking forward to having fun with you over the next 10 weeks. Next week, we're going to talk about vaccine basics and understanding the Asip schedule. And then we'll go into storage and handling and cold chain. How do you overcome common objections and all those kinds of things. So the other thing, and I know we're a little bit behind, we're going to keep the line open for just a few minutes to make sure we get through all the questions on the chat. But Lou's won the $50 gift card already. But for other people, and we'll email it to you, we at Papa John's would love to thank you for all you do for vaccines. We have a promo code that you can use for the rest of the summer to receive 20% off of all your orders from Tappy. And Tappy will also get, I think, 10% of all of those as well. And special thanks to Papa John's for giving us all that. So, all right. Thank you all. Sorry we went a few minutes over, and we'll stay open for the chat. And if you want to unmute yourself and ask questions, go for it too.
Hi, Rebecca.
Yes.
In our, I'm just like 4 months here, but on our vaccine, it won't transmit automatically to ACEs. So how could we resolve that one? I used to work in one of the Native Americans, and it, transmits automatically, and it helps a lot.
Mm-hmm.
But for us, we have to enter it manually every time. Do you think that can be resolved?
Yeah, we'll get you in touch. You have to work with DHS to get the HL7 interface, and they'll work with the EMR vendor. But yeah, it's certainly possible. So we'll make sure to email you who to get in touch with to start that process. I would imagine that, is that taking a little bit longer than typically, Macrina, just because so many offices are doing it right now?
Right now, folks are saying it's taking 2 weeks to get a return phone call. It's just that all these new providers are on board with COVID vaccine who normally weren't connected to ACEs. So yeah, just call and wait and keep calling. But yeah, they're really overwhelmed.
Mm.
Yeah. Thank you.
Yeah. There was a chat in there about having Pfizer, Macrina. Do you have to wait 4 weeks to give?
No. No, you don't have to wait for any of them, adults or children. They can all be given on the same day or any time frame apart. There's no waiting before or after COVID vaccine.
So we can all co-administer now, which is going to be, it's going to make a huge difference. 26 million vaccines that we didn't get this year.
That was a game changer. When they came out and said we could do that, that was a huge game changer for those of us who immunize kids. Can you imagine the nightmare of trying to keep that all in pace and separate, and 2 doses separated by 3 weeks, and then trying to get Tdaps and MMRs and all that other in? Would have been a nightmare for reminder recall.
Right. There's a comment here about Hep A for school requirements.
Hep A is not required for school. It is required for childcare or any preschool program within Maricopa County. And honestly, we don't have a problem getting older kids to take Hep A. We just kind of tell them how it's spread, and most parents say, yep, my children are gross and don't wash their hands, and they get it to them. So that's a pretty easy one to administer.
Isn't that fecal oral?
It's fecal oral. Yep, yep, yep. And so when you're talking about like teenagers and adolescents and you tell them how it's spread and how they share food and have their hands and, you know, the chili Cheetos and all that other stuff, most parents kind of, they're like, oh yeah, I've seen that. Yeah, let's give it.
Yeah.
Rebecca, I just want to verify that one. Because last March we volunteered to, I usually volunteer to give COVID shots. And one of the doctors from the health department said that they have to delay 2 weeks to get other vaccines or 2 weeks before to get the COVID vaccines. So is that still in effect or?
No, that changed probably about maybe a month, 6 weeks ago. That changed.
Okay.
When they came out with the recommendation that children 12 years of age and older can get Pfizer, that's when they changed it and said that you can co-administer the vaccines and that there is no waiting period between vaccines and COVID vaccine.
Oh, okay, thank you.
Bye.
Okay. All right. Well, I think we're probably set until 2 weeks from now. So thanks everybody, and we'll see you in 2 weeks. Bye-bye. Up. And share.